So the number one thing I'll mention is glaucoma. Glaucoma is a condition that patients come in with sometimes, and they don't know they have. Glaucoma itself, it can be thought of as a group of diseases that all affect the nerve in the back of our eyes responsible for vision, the optic nerve. There are many different types of glaucoma, actually, but the main one we're going to talk about today is open-angle glaucoma. As you can probably guess from the terminology, there's also a closed-angle glaucoma, but closed-angle glaucoma is typically painful, and patients come in with it as there's an earlier awareness that something is wrong. With open-angle glaucoma, on the other hand, it can be, it's a slow-moving disease process, but it's painless and progressive. And furthermore, the vision loss with glaucoma typically begins in the peripheral vision off to the side where patients don't notice it, and then it progresses toward the center of the vision. So, of course, this is very dangerous because a lot of vision loss can occur before it's very noticeable. It's also important to mention that vision loss from glaucoma cannot be cured or brought back. All of the treatments for glaucoma center around trying to stop it and really just keep it from getting worse. Thus, it is very important to be screened for glaucoma. In terms of risk factors for glaucoma, some of the biggest ones are age over 40, patients with a family history of glaucoma, patients who are African-American, Hispanic, or Asian heritage, patients with a history of an eye injury, history of diabetes, high blood pressure, or migraine, and high eye pressure. These are all risk factors for glaucoma. And notice with this last one, this is really, this is one that to really know you have eye pressure, you have to, it's one of those things to be screened for. And, this is really one of the only risk factors that's, truly modifiable and that it can be treated. We know from studies that high eye pressure worsens glaucoma, and the various treatments for glaucoma really center around treating it by lowering eye pressure. We try to lower their eye pressure to the point that the glaucoma is no longer worsening, and that specific pressure that the glaucoma is not worsening anymore is actually different for every eye that has glaucoma.